Welcome to an introduction to veterinary dispensing. This program will provide you with general knowledge concerning veterinary prescribing. First, I will identify the most commonly prescribed pet medications seen at local pharmacies. I will also outline common dosing differences and toxicities to be aware of when dispensing drugs to pet patients. I will discuss some of the challenges pharmacists face when filling pet prescriptions from a veterinarian. And lastly, I will cover some of the veterinary medications that may be coming to your pharmacy. One thing I have noted when dealing with human healthcare providers is some confusion about the terms that veterinarians use to describe their relationships. Our patients are the animal, and the client is the pet guardian. If it helps, you can remember that the patient gets the pill, and the client has the credit card. Also, our patients don't have symptoms, they have clinical signs. A pet cannot describe what's going on, so we have to rely on the signs that we can see in order to diagnose and treat our patients. Probably the one that is most confusing for pharmacists, SID. This means once daily, and we use this abbreviation commonly. In our defense, it's a real abbreviation. It's Latin for semel in die. There are obviously many differences between people and pets. One significant difference is the accelerated lifespan of our pet patients. To give you an idea of the differences, since you may not be familiar with pets, a newborn is a neonatal puppy or kitten that is from 0 to 2 weeks of age. The infant stage is from 2 to 4 weeks of age. Our pediatric patients are from 3 weeks to 1 year of age. When dosing pets of these ages, we need to understand that drug clearance does not achieve adult capacity until 3 months of age, so there may be changes in dosing amount or dosing interval that you may encounter. The adult stage is from age 1 to 8 years of age. And lastly, our geriatric population is defined in general as a pet that is greater than 8 years old. It is a common misunderstanding that 7 years in people is equivalent to 1 dog year. This is a misnomer. Our patients are sexually mature teenagers at 6 to 8 months of age. Aging also varies by pet size. For example, giant breeds like the Great Dane have a life expectancy of 8 years, so they are geriatric at about 6 years of age. By the same token, a 6-year-old cat is just starting in the prime of their life. Another consideration from a veterinary standpoint is the variability in the size of our patients. We may be dealing with a patient as small as a parakeet at 1.5 ounces to a 1,200-pound horse. We also have differences in breed. For example, greyhounds have limited body fat. This must be taken into consideration when dosing drugs that are stored in the fat, as it may result in higher blood levels, since there are limited fat stores in which to redistribute. Another drug sensitivity we see is with the herding breed dogs. These are commonly referred to as white-footed dogs and include collies, Australian shepherds, and shelties. They have a sensitivity to avermectins. This is a commonly used medication to prevent heartworm disease. And obviously, we treat a wide variety of species. However, the majority of the prescriptions that you will encounter are going to be for cats and dogs, so we will place our focus here. So why learn about dispensing medications to clients that represent such a small percentage of your daily dispensing day? Many of you may see veterinary dispensing only sporadically. However, the world is changing, and we are seeing an increase in clients that are seeking their medications from a local pharmacy, as well as large pharmacy retailers who are capitalizing on the opportunity this represents. In most cases, this is a new market segment that has the potential for exponential growth. The 2011 pet pharmacy market was estimated to be $8.6 billion for prescription and OTC pet medications. Additionally, right now, only about 10% of this dispensing occurs outside of veterinary hospitals, but that number is changing on a daily basis. This shift presents challenges to the dispensing pharmacist. There is no question that pharmacists have deeper knowledge and expertise in specific medications that are dispensed, much more experience than a veterinarian. And veterinary schools are slowly but surely decreasing the amount of pharmacology offered each year to make room in the curriculum for other medical challenges. This leaves you, the pharmacist, in the unique position of being an expert at something you may or may not be prepared for. Believe it or not, many veterinarians are not aware that they can only dispense medications to their own clients. Additionally, when a client walks out of a clinic with a prescription, they often think they can call on other veterinarians in the area and have them dispense it to them. State pharmacy law requires that a pharmacist dispense medications. Veterinarians can only dispense in the context of the VCPR, or Veterinarian Client-Patient Relationship. This places the burden of quality assurance in the hands of professionals who may have limited to no experience with the physiology of the target species. As you already know, many of the medications we use in veterinary medicine are approved for use in people. These medications have extensive testing in the human species, but not so much for our pet patients. Veterinarians dispense human medications extra-labelly. This lack of experience can result in some serious consequences. In a recent survey by the Oregon Veterinary Medical Association, 35% of veterinarians said that they have experienced prescription errors from a retail pharmacy. That is, 1/3 of the prescriptions have some error or perceived error associated with them. The most common reported errors were a change in dosage or substituting one medication for another. These changes can result in significant health issues, even death of the pet. This is a screenshot from a television report where the dosage should have been 2.25 milliliters and was entered as teaspoons. Unfortunately, in this case, the pet did not survive the error. Now, this is not to say that everyone is making mistakes. I believe in most cases it is being unfamiliar with the dosage for commonly prescribed medications in our pet species. This example provides a significant point of knowledge. In veterinary medicine, we rarely if ever prescribe medications by the teaspoon or tablespoon. In general, that does not provide us with enough precision. We usually dose by the number of milliliters. As you already know, many of the medications we use in veterinary medicine are approved for use in people. These medications have extensive testing in the human species, but not so much for our pet patients. Veterinarians dispense human medications in an extra-label manner. So we have already established that retail pharmacies are seeing more veterinary prescriptions coming through the door. Another question is, since these medications are not authorized by the FDA for a pet species, is it legal to dispense them? The short answer is yes. The long answer is yes, because of the Animal Medicinal Drug Clarification Act of 1994, which talks about extra-label use of FDA-approved medications in drugs. This is a portion of that act. Under the provisions of the Animal Medicinal Drug Use Clarification Act of 1994, the FDA recognizes the professional judgment of veterinarians and allows the extra-label use of drugs by veterinarians under certain conditions. Any drug used in an extra-label manner is by definition a prescription drug, since the involvement of a veterinarian is required. Extra-label use of drugs may only take place within the scope of a valid veterinarian client-patient relationship. Extra-label use is limited to circumstances when the health of an animal is threatened or suffering, or death may result from the failure to treat. There is no approved animal drug that is labeled for such use that contains the same active ingredient in the required dosage form and concentration, except where a veterinarian finds, within the context of a valid veterinarian client-patient relationship, that the approved animal drug is clinically ineffective for its intended use. The prescribed or dispensed extra-label drug, prescription legend or over-the-counter, must bear labeling information which is adequate to ensure the safe and proper use of the product. So, extra-label use of drugs in treating animals is allowable only by licensed veterinarians in the context of a valid veterinarian client-patient relationship. Because extra-label use of animal and human drugs in non-food producing animals, which includes companion, sporting, and exotic animals, does not ordinarily pose a threat to public health, AMDUCA provides legal authority for veterinarians to utilize human medications. Extra-label use is limited to circumstances when the health of an animal is threatened or suffering, or death may result from the failure to treat. If there is no approved animal drug that is labeled for such use and contains the same active ingredient in the required dosage form and concentration, except where a veterinarian finds, within the context of a valid VCPR, that the approved animal drug is clinically ineffective for its intended use. When labeling these medications for dispensing, there are some specific information that must be provided to the pet owner. Laypersons cannot be expected to have sufficient knowledge and understanding concerning animal diseases, pharmacology, toxicology, drug interactions, and other scientific parameters to use these drugs in any way other than as labeled. It is imperative that this information is conveyed correctly. If there is any question about the medication or other information, the veterinarian should be contacted. In addition to extra label use of human medications, you may also be called on to prescribe approved veterinary medications. For most pharmacists, this is an area with which you have the least experience. However, most, if not all of the medications are in drug classes that you are familiar with, and your existing knowledge brings a valuable asset to the table. You will note that most of the FDA-approved veterinary medications are labeled for use in dogs. Very little research is done to approve medication for cats, which is unfortunate and something that the industry is trying to change. What are the specific physiological differences between pets and people? First, there are more similarities than differences. However, the differences can be significant. I am focusing on the key points that I would like you to take away. First, cats have limited hepatic glucuronidation. Therefore, metabolism of certain medications is prolonged or dangerous. The takeaway from this is that any medication which requires the active form of the medication to be transformed in the liver may have a dose that is different than expected. Additionally, if there is a choice for a medication that doesn't require transformation, that is the better choice. One common example of this is prednisone. Cats can and do get prednisone, but prednisolone is preferred for cats. Also, there are some additives that should never be given to our pets. Xylitol, for example, can cause life-threatening consequences. Xylitol, a sweetening agent found in medications and many sugar-free foods, causes liver damage and life-threatening hypoglycemia. It causes a dramatic increase in insulin, and 50 milligrams per pound of xylitol can cause hypoglycemia. One thing I hear commonly from pharmacists is that most human drugs are tested in dogs at the pre-approval stage. Shouldn't this give us a dose? Not really. When the testing is done, it is done for safety, not for effectiveness, and not to optimize the dose. As mentioned in the previous slide, any medication that requires hepatic transformation needs special attention when administering it to the cat. Cats are more sensitive to opiate medications because of this effect. You should also be judicious when using medications that have a benzoate structure. We can see the accumulation of benzoate in the liver with long-term use. An example of this is metronidazole benzoate, which is often used in compounding metronidazole due to the fact that it is so much bitter than the regular metronidazole. Of these toxicities, the most serious and striking example of toxicity in the cat is with acetaminophen. Because cats lack glucuronidation ability, the acetaminophen cannot be metabolized properly. Also, the cat's red blood cells are sensitive to the reactive metabolites, and their hemoglobin becomes oxidized, resulting in methemoglobinemia. The resulting loss of oxygen-carrying capacity results in suffocation. The toxic dose in the cat is 50 milligrams per kilogram. If cats are not treated within 17 hours of ingestion, they will die despite appropriate therapy. Acetaminophen is one of the most common medications, and people think of it as very mild, with very few side effects. As a result, some people will have a cat with a simple upper respiratory infection and try to medicate it themselves with over-the-counter medication. It is just tragic to see the owner that has just administered a lethal dose of medication to their beloved pet to make it feel better. If you can stop even one person from making this tragic mistake, this webinar is totally worthwhile. On the other hand, dogs are more tolerant of this medication, and we see it fairly commonly prescribed when it is combined with codeine. What medications are you going to be asked to dispense on a regular basis? Well, the list is long, but we will address those that you will see most frequently. Medication is prescribed to address a number of common diseases. Endocrine problems, pain, seizures, allergy, and diabetes are likely what you are seeing right now. Veterinary medications are making their way to the pharmacy near you and include medications to prevent heartworm disease as well as flea and tick control medications. Let's start with hypothyroidism. This is a commonly diagnosed endocrine disorder in the dog and is the result of antithyroid antibodies destroying the thyroid gland. We see generalized hair loss, lethargy, weight gain, and seeking warm places to rest. Fortunately, the treatment for this is pretty straightforward. Daily supplementation with levothyroxine. Easy peasy, right? Easy peasy for the veterinarian, Panic for the pharmacist. Our doses to treat dogs with levothyroxine are very high compared to what you are accustomed to. At a dose of 0.1 milligram per 10 pounds, it is absolutely normal for an 80-pound dog to receive 0.8 milligrams of levothyroxine twice a day. This dose is one that catches most pharmacists off guard, resulting in the most callbacks for veterinarians. We also see thyroid disorder in the cat, but they have the opposite problem. In older cats, we commonly see hyperthyroidism. This disease is generally a result of the overproduction of thyroid hormone due to a benign tumor in the thyroid gland. These cats will show increased vocalization, weight loss despite polyphagia, and often have a heart murmur. We treat this disease in several ways. The best way to treat them is with radioactive I-131. This treatment is not available at the local vet, but they will know where to refer a pet if this treatment is elected. Most cats, however, are treated orally with methimazole. Dosage for this medication is 1.25 milligrams to 5 milligrams per cat twice daily. The dose may be increased beyond this depending on the cat's disease, and I have seen doses as high as 10 milligrams twice daily. You may also receive requests to compound this medication. Methimazole compounds well into an oral liquid. It is also available at compounding pharmacies in a transdermal form where the gel is rubbed into the ear flap. Transdermal treatment is the least preferred method and should only be used in patients that cannot take the medication orally. Most cats, however, are treated orally with methimazole. Dosage for this medication is 1.25 milligrams to 5 milligrams per cat twice daily. The dose may increase beyond this depending on the cat's disease, and I have seen doses as high as 10 milligrams twice daily. You may also receive requests to compound this medication. Methimazole compounds well into an oral liquid. It is also available from compounding pharmacies in a transdermal form where the gel is rubbed into the ear flap. Transdermal treatment is the least preferred method and should only be used in patients that cannot take the medication orally. Seizures are common in veterinary medicine. Both dogs and cats have seizure disorders, and for both species, phenobarbital is the medication of choice. You will see prescriptions for this medication a lot, in part because many veterinary hospitals don't want the hassle of the record keeping beyond what is in the medical record. For dogs as well as cats, veterinarians may do a loading dose of 16 to 20 milligrams per kilogram. Maintenance dosing is based on blood levels, but in general the maintenance dose for cats is 1 to 5 milligrams per kilogram every 12 hours, and in dogs the maintenance dose is 2 to 5 milligrams per kilogram every 12 hours. Puppies and kittens may have an increased dosage due to their high metabolism. The primary side effect that we see from phenobarbital is sedation. You should also note that it is common throughout the life of the pet to have the dose increased due to more efficient metabolism of the medication. The second most common seizure medication is potassium bromide. KBR is generally compounded into either a capsule or a liquid. It can be used as a sole agent or given along with phenobarbital. It is generally not used in cats because they experience adverse respiratory effects. Potassium bromide can also cause sedation, and if it is administered in the capsule form, vomiting is common. This is due to the endothermic effect when the gelatin capsule dissolves and the bromide mixes with the stomach contents. For this reason, it is often better to give the capsules with food. Unless your pharmacy does a lot of veterinary compound, it is unlikely that you will see a lot of prescriptions for potassium bromide. But many of the phenobarbital canine patients you see may also be on this medication and thus have a lower phenobarbital dose than you would expect. Veterinarians are now using a number of new drugs to control seizures in pets. The most common of these is gabapentin. The dose for gabapentin in the dog is 10 to 30 milligrams per kilogram every 8 hours and 5 to 30 milligrams per kilogram every 8 hours in the cat. 3 times a day dosing can sometimes be challenging for pet owners due to their work schedule. Another important note for gabapentin, the liquid form contains xylitol and should not be used in dogs. We are also seeing levetiracetam and zonisamide used more frequently to control seizures as well. Another common disease we see in pets is diabetes. As with people, we see both type 1 and type 2 diabetes. Type 1, or insulin-dependent diabetes, is seen more commonly in dogs, whereas type 2 diabetes is more common in the cat. Although occasionally we do use oral hypoglycemic drugs to treat feline diabetes, it is often unsuccessful. Owners may find giving tablets more difficult than giving an injection. Pets are remarkably tolerant of subcutaneous injections, and there is little chance of the owner getting bitten if their hands are farther away from the teeth. Of the oral hypoglycemics, glipizide is usually the most successful as it stimulates endogenous insulin secretion. However, it does require functioning beta cells to work. The effect also doesn't last very long, with the peak effect 15 minutes after administration. The dose for glipizide in the cat is 5 mg per cat BID with a maximum dose of 7.5 mg BID. You may also see prescriptions for acarbose. Acarbose acts by reducing glucose absorption from the gastrointestinal tract and can be used in addition to insulin therapy in cats and dogs which are meal-fed a high carbohydrate diet. Dietary manipulation with an increased protein or fiber is very common for diabetic pets, but if the pet has concurrent hepatic or renal disease, these require a low-protein diet, and acarbose can be useful. However, most renal or hepatic impaired cats usually also have a reduced appetite and need to have food available at all times. This greatly reduces the efficacy of the medication. We generally choose these medications only when the pet owner is adamant about not giving an injection. Consequently, the drug of choice to manage most diabetic pets is insulin. There are several types of insulin available to the veterinarian. There is a veterinary-approved insulin called Vetsulin, and this has just recently come back to the market. It had been unavailable for several years, and its availability has been undependable in the past. For this reason, many vets start their diabetic dogs on NPH insulin. Generally, this needs to be given twice daily. Dosing varies individually and is usually based on clinical signs as well as glucose curves and monitoring. Diabetes in cats is also treated with insulin, but with cats, dietary changes that include a high-protein diet modification is a crucial part of treatment. Glargine insulin is currently the insulin of choice for cats. In many cases, between glargine insulin and dietary therapy, as many as 80% of cats diagnosed with diabetes go into remission and no longer need insulin. Recent data suggests that the long-acting insulins provide better glycemic control and reduce the risk of clinical hypoglycemia if they are given twice a day and combined with a low-carbohydrate diet. Two things to note. When dispensing insulin syringes, you should always ask the client which insulin is being used. Vetsulin requires U40 syringes, not U100 syringes. Also, in veterinary medicine, we generally advise our clients not to discard the glargine insulin after 28 days, but tell them they can continue to use it for 3 to 4 months. One issue that has come up among veterinarians is that although Novolin and Humulin are NPH insulins, they are not equivalent in the dog and should not be substituted for each other. Also, as we discussed before, although insulins are considered over-the-counter products in human medicine, since they are being used in an extra-label manner in animals, they do require a prescription and a label in accordance with Amduca. You may also be asked your opinion regarding a glucometer. Generally, people may choose either a human product or a veterinary product like the AlphaTrack. A journal of the American Veterinary Medical Association found that the veterinary glucometer is more consistent at higher glucose concentrations. In veterinary medicine, our patients tend to have higher maintenance blood glucoses since the consequences of hypoglycemia when a pet is left at home alone are more severe than the consequences of having higher blood glucose. Also, when first diagnosed, glucose levels in diabetic dogs and cats can be upwards of 600 grams per deciliter. In general, a glucose monitor that requires the smallest sample is preferred. In most cases, the pet owner will sample capillary blood taken from the margin of the pet's ear. The key with blood analyzers is to choose one and stick with it. On the East Coast, diagnosis and treatment of allergies in pets is a daily occurrence. Unlike people, our pets with allergies tend to lick and scratch themselves, sometimes to the point of excoriation. To try to prevent this, we often prescribe antihistamines. This is another medication with a dosage that may take pharmacists aback. For example, we will administer diphenhydramine at a dose of 2 to 4 milligrams per kilogram 2 to 3 times a day. That means a 75-pound dog, such as a golden retriever, a dog very prone to allergies, can get 136 milligrams up to 3 times a day. Now, most veterinarians use 2 milligrams per kilogram, but this dose is correct. I once prescribed a 100 milligram dose of Benadryl for a German Shepherd, and the pharmacist refused to fill it. He just couldn't believe me when I told him it was the correct dose. As with people, the most common side effect is sedation, but I am always impressed with the amount of antihistamine you can give a dog, and they will continue to act normally. It is not just diphenhydramine that has high dosing. We also use a lot of hydroxyzine to treat allergies, and again, it is quite a high dose compared to what is dispensed for people. In the dog, the dose is 2.2 milligrams per kilogram, up to 3 times daily. The dose in the cat is 5 to 10 milligrams per cat, also 2 to 3 times daily. You can use hydroxyzine hydrochloride and hydroxyzine pamoate interchangeably. We also use chlorpheniramine. This is most commonly seen in the cat, and the dose is 2 to 4 milligrams per cat. When you see a big dose of antihistamines come across your station and the patient is a pet, chances are good that the dose is correct. But if you are concerned, please give the veterinarian a call so that you are comfortable with what you are dispensing. Antibiotic prescriptions are often taken to retail pharmacies due to the low cost for a 30-day supply. Thus, it is much more cost-effective for pet owners to purchase these products from the local pharmacy instead of from their veterinarian. With the offered discounts, these products often sell for less than what the veterinarian's purchase price would be. 2 commonly dispensed medications include amoxicillin and cephalexin. The dose for amoxi in dogs and cats is 5 to 10 milligrams per pound, twice daily. For small dogs and cats, amoxicillin is often dispensed as a suspension. One common error that veterinarians make is they are not familiar with the standard size bottles you keep in your pharmacy. If we prescribe a bottle size that would require a special order or is more expensive than a regular standard size, we would greatly appreciate a call with that information. Often, the prescription can be changed to accommodate what you have in stock. Fluoroquinolones are another frequently prescribed antibiotic class. For this class, there are 2 veterinary forms that have a significant advantage over ciprofloxacin. Cipro has a 40% bioavailability in the dog versus 80% in people. The bioavailability in the cat is only 0 to 20%. So in most cases, it is a better choice to utilize the veterinary-approved products of enrofloxacin and marbofloxacin. Doxycycline is another commonly prescribed antibiotic. The dose for doxycycline in the dog is 3 to 5 milligrams per kilogram and 5 milligrams per kilogram in the cat. In cats, it is very important to either give the doxycycline as a liquid or to follow the tablet or capsule with water. This will prevent the occurrence of esophageal strictures, which have been reported if the medication does not complete its journey to the stomach, but instead begins to dissolve in the esophagus. We have already discussed acetaminophen in the pain medication category, but this category is one of the few areas where there is a good selection of products that have been approved for veterinary use. The most commonly approved NSAID in the veterinary space is carprofen. It is in the same general category as ibuprofen, but this medication is much more effective in dogs. In fact, ibuprofen in dogs is one of the least effective NSAIDs and often causes vomiting. Also, gastric lesions occur at a dose that is below therapeutic levels. Carprofen, on the other hand, has been used for many years and is generally safe at appropriate doses. 2 other NSAIDs you may see prescribed include aspirin and piroxicam. Buffered aspirin can be used in dogs and cats, but as by now you can probably predict, the dose in cats is much reduced due to their special metabolism. In dogs, the dose of aspirin is 10 to 25 milligrams per kilogram twice daily, and in cats it is 10 milligrams per kilogram every other day. Aspirin can be used to control pain and fever, reduce inflammation in dogs receiving treatment for heartworm disease, and as an antithrombotic in cats with cardiomyopathy. Piroxicam can also be used for pain, but is most likely that the patient on this medication is being treated for a bladder tumor called transitional cell carcinoma. Dogs are dosed at 0.3 milligrams per kilogram once daily, and cats receive the same dose, but every 24 to 48 hours. Right now, Celebrex is the only COX-2 inhibitor available for people. In veterinary medicine, however, there are a number of approved products, including Deramax, which is Daracoxib, Previcox, which is Ferocoxib, as well as Metacam, which is an oral liquid form of meloxicam. Most of the category of pain control is focused on the canine population. There are very few options for pain in cats. Single doses of meloxicam and carprofen are approved for cats, but cats are very sensitive to these products, and they are not approved for chronic use, and as such can only be used in an extra-label manner. Recently, a product called Onsior, robenacoxib, has been approved for 3-day use in cats for post-surgical pain. As you can see, there is a large gap in the product offering for cats. Because of a relatively robust pain medication offering, the most common medication that you may see prescribed through the retail pharmacy is tramadol. The dosing for tramadol is 1 to 5 mg per kilogram every 6 to 8 hours in the dog and 12.5 mg per cat twice daily. Side effects of tramadol include sedation and CNS signs. Now, I would like to transition to antiparasitic therapy. This is likely a new area for most of you, so I will go over the incidence and disease transmission and consequence of these diseases. I would like to start with heartworm disease. Heartworm disease is just like it sounds, worms in the heart. Since this disease is transmitted by mosquitoes, it follows that areas where the mosquito population is largest are where we see the highest incidence. Heartworm disease is becoming more widespread than ever before. This is due in part to Hurricane Katrina. Because so many dogs were displaced after the storm, there was a nationwide rescue effort, and the dogs from Louisiana were relocated to families all across the country. Many of these dogs were heartworm positive and served as a source for the disease in places where previously it had rarely been seen. Heartworms achieve their full life cycle when they infect a dog. This becomes a patent infection in that the worms which reside in the right ventricle are able to reproduce and create babies or microfilaria, which are then extracted by the mosquito during a blood meal. There is a maturation phase in the mosquito, and the infective larvae are then spread to the mosquito's salivary glands to be transmitted to a new host, also in the course of a blood meal. Since these larvae are in the salivary glands, every time a mosquito takes a meal, there is the potential for transmission. Mosquitoes feed on any number of warm-blooded mammals. Thus, cats can also be exposed to the disease. Since they are not the natural host of the disease, in fact, is a bit different. Cats usually only have 1 or 2 worms in their heart, and that makes it harder to detect the disease in the cat. So, what are the signs that a pet is infected with heartworms? In most cases, there are no signs, and the disease is discovered by routine yearly testing. In dogs, which can have many worms in their heart, we can see them cough, have exercise intolerance, weight loss, and fluid retention in the abdomen. Cats have a much smaller worm burden, and the disease presents quite differently. We see signs of vomiting and respiratory distress that is often confused with asthma. Unfortunately for the cat, a not uncommon clinical sign is acute death. I think you can appreciate why disease prevention is so important. Prior to giving dogs and cats heartworm preventive medications, we check their infection status. This is done with a blood test. In dogs, the test checks for heartworm antigen. In cats, we utilize both antigen and antibody testing. Radiographs can also detect the disease, but this doesn't catch the disease until significant damage has already been done to the pet. Heartworm prevention medications are classified as macrolide lactones and include the ivermectins and milbemycin. They kill the parasites because they have a high affinity for the nematode-specific glutamate gate chloride channel. The macrolides trigger chloride ion influx, which hyperpolarizes the parasite's neurons. The result is paralysis and death. The doses used to prevent heartworm disease are extremely low, measured in micrograms in the case of ivermectin. These drugs, quote-unquote, work backward, in that they need to be administered on a monthly basis and kill the larva that the pet has been exposed to in the previous month. At these doses, there are very few problems. There is, however, sensitivity in certain breeds of dogs. Herding breeds, such as Collies, Shelties, Australian Shepherds, and Old English Sheepdogs, have a genetic sensitivity to larger doses of these drugs. There is a genetic test to determine if a specific patient is sensitive. However, at the low heartworm preventive doses, we generally don't see any problems. The most common side effect to these drugs is vomiting. In larger doses or toxic doses, neurologic signs can be seen. As a note, all of these medications are formulated as oral chewable tablets. HeartGuard Plus is especially tasty, and it is common for a dog to eat the entire box if they get a chance. In most cases, this doesn't cause any problems and is below the toxic threshold for most pets. Unlike other medications we have discussed up to this point, topical medications to control only fleas and ticks are not FDA-approved products. They are regulated by the EPA. They do not require a prescription. These medications will not be behind the pharmacy counter, but are some of the most common medications used in our pet population, and you may be asked to provide an opinion on their use. Oral flea control medications are generally FDA-approved products. One reason these medications are critical is they help prevent some very serious diseases. Tick-borne diseases such as Lyme, Rocky Mountain spotted fever, as well as blood parasites are common. And flea allergy dermatitis is a common problem in pets. Fleas also carry tapeworm. Fleas can be acquired from other animals or from the environment. Flea eggs are not sticky and when laid on the pet's fur fall freely to the ground where the larvae emerge and consume organic material. They then pupate and emerge as adults. Fleas survive well as long as there is adequate humidity and no direct sunlight. Thus, they can easily infest the average house. Flea and tick medications are generally topical and applied to the skin on the back of the neck and along the back. The #1 product in the country is Frontline Plus, which kills adult and immature fleas as well as ticks, and is available for both dogs and cats. In the last 3 years, there has been an explosion of new products available, many of which have similar ingredients. The best medications kill both adult fleas and the immature phases as well. The kill of the immature forms is accomplished by administering an insect growth regulator that prevents maturation. Here is a list of the most common flea control compounds and their proprietary names. The most common side effect for the topical medications is irritation at the application site and salivation from licking the product. Most adverse reactions are seen in small dogs, especially those under 20 pounds. Products containing the chemicals cyphenethrin and permethrin were especially problematic for small breed dogs. Adverse reactions in cats were often the result of the cat either being treated with a product intended for a dog or through exposure to a treated dog. Cats treated with products intended for dogs have a high rate of serious reactions and even fatalities. Another point of confusion is that pharmacists will ask vets for their DEA or NPI number. Most vets do have DEA numbers, but not all. These veterinarians can still prescribe uncontrolled substances. Vets can also be asked to provide an NPI number. This is actually illegal for a veterinarian to have an NPI number, as this is a number that is issued to people who are performing services that are billable under Medicare, Medicaid, or billing electronically through a human health insurance program. Vets cannot and should never be doing this. And now I have a few miscellaneous items that just didn't fit nicely into other categories, but I thought would be useful and interesting for you. For example, in pets with cardiac disease, you may see diltiazem prescribed. The prescription for generic Dilacor may read, open capsule, remove tablet, and give a half a tablet. We get calls from pharmacists to let us know that the tablet shouldn't be cut. We do it anyway, and it is often the easiest and least expensive option to medicate the pet. Another one is if you give Bactrim oral suspension to a cat. Be prepared for some extreme foaming. It is very bitter, and the amount of salivary foam a cat can make when given this medication is quite impressive. Another point, there are 2 potential adverse reactions to drugs that we see uncommonly, but they do occur. Oral diazepam can cause hepatic failure in cats, and neomycin, polymyxin, bacitracin eye ointments have been shown to cause anaphylactic reactions in cats, so their use is strongly being discouraged. Another item is when we prescribe chewable tablets to pets, they need to be able to be pushed down as well. As hard as I have tried, I have never been able to reason with a dog or a cat to get them to chew something that they don't want to chew. Speaking of getting pets to take medication, that can sometimes be a challenge. We do have a few tricks up our sleeve. Disguises are the most common way to get meds into pets. Put the pill in something tasty, and hopefully it will go down smoothly. However, cats and dogs have an extraordinary sense of smell, and can sometimes detect the medication and refuse it. In these cases, we sometimes need to be a little more ingenious. You can use a pill popper, which is a plunger with a rubber tip and usually is about 6 to 9 inches long. You place the pill in the rubber tip and put the device in the mouth so that the tip is at the back of the mouth, and then pop the pill down. Lastly, some pets require compounding to take their medication. We use special flavoring for pets. Tuna works great in cats, and bacon is a good flavor for dogs. They really are not too keen on the flavors that you are accustomed to using. Cherry and grape just don't fly with cats. There is a lot of misinformation on the internet, some of it on pharmacy websites that are unfamiliar with veterinary medicine. I found a few examples. One website lists medications for mental health in pets as well as genetic diseases. Pets have behavioral problems. I have never seen mental health anywhere in veterinary literature, and to my knowledge, there are no specific drugs to treat genetic diseases. Another site had a number of errors related to the way they categorize pet medications. For example, potassium citrate is listed as a laxative. In veterinary medicine, this is used to alkalinize urine. They also listed Simplicef, a brand name for cefpodoxime, as an antifungal medication. A different site's pharmacy link showed under pet medications links to a farm store with calf boluses and treatments for dairy cattle. My point here is that even reliable, large human pharmacies are really just learning about veterinary medicine, and they have a long way to go. As veterinary products make their way into your pharmacies, you need to be aware of the gray market issue. Most veterinary manufacturers either sell directly to veterinarians or to veterinary distributors that sell directly to veterinarians. Brand name veterinary medications are making their way to large online direct-to-consumer pharmacies as well as big box stores through the gray market. These products are diverted from the manufacturer channel to an unknown channel where they end up in pharmacies and other outlets. Some of this is due to veterinarians placing orders and reselling the product to pharmacies, or the manufacturers are also selling to pharmacies without acknowledging it. This product diversion can result in incorrect shipping and storage conditions, which can affect the efficacy of the medication. Consequently, manufacturers no longer honor the product guarantees that they usually provide. For example, if you buy Revolution from your veterinarian and your pet gets heartworm while on the treatment, Zoetis, the manufacturer, will help pay for the treatment. If you get the same product from an online or big box pharmacy, they will not. Additionally, many of these products have rebates available, but only if you get the product from your veterinarian. The lack of a good drug pedigree is an issue and may make pharmacies susceptible to obtaining poor quality or adulterated products. Working together, veterinarians and pharmacists can create a synergistic relationship that will really benefit pet health. Veterinarians need to be more aware of pharmacists' needs and be clear with their expectations. Pharmacists should use caution when changing or substituting medications from what is written on the prescription. It is also helpful if pharmacists will call veterinarians if another size tablet or bottle is more readily available compared to the one that is written on the prescription. Both vets and pharmacists need to be flexible but accurate. Also, just between us, veterinarians are nicer than physicians, and we usually come to the phone when you call us. As medical professionals, we need to approach the issues with humility and acknowledge that each have strengths and weaknesses. If we address issues that we are unsure of with communication and good resources, both groups will gain knowledge and competency. Competency evolves over time. Each prescription filled for a pet increases knowledge and experience and makes us part of a great healthcare solution. Here I have listed some of the best resources that you may want to invest in if you are seeing an upswing in veterinary dispensing. First is Plum's Veterinary Drug Handbook by Donald Plum. This book is a comprehensive look at medications used in all species and includes drug descriptions, adverse reactions, drug interactions, as well as dosing information. A second resource is Don Booth's Small Animal Clinical Pharmacology and Therapeutics. This is a great text for those of you that want more in-depth knowledge on the chemistry of the medications. A third resource is the Compendium for Veterinary Products. This volume contains labels of veterinary-approved products. And lastly, VeterinaryPartners.com has some great information on disease states and is written in the language of the client to make it easy to understand quickly. I hope that you find these resources useful. I reference all of these regularly when speaking with vets and pharmacists.